I just want to welcome everyone and say good morning. This program in particular is regarding the special education and the reopening plan, but more so on the health and safety measures that will occur as we plan on our opening in January. So we can go to the next slide. And I think we kind of introduced ourselves, but if you're just joining us, I'm Desiree Richmond and I'm the acting chief of special education. And I'm gonna have my co-presenters introduce themselves and then we'll move on.
Thank you, Desiree, and welcome everybody. My name is Melissa Pittman and I'm an acting director in the special education department.
Good morning, everybody. My name is Erin Grotman. I am the coordinator of student health services for the district.
And good morning, everyone. I'm Stacy Darby. I'm the coordinator of environmental health and safety for the district.
And I'll introduce myself again. My name is Khadijah Mohammed. I'm the director for Office of Parent Engagement. I'm supporting this breakout session. And if you'll notice, I changed my screen name to Chat With Me. If you have specific questions, you can place them in the chat. But I think our group is also intimate enough that once we get to the question and answer session after the presentation, we can go ahead and unmute and we'll raise our hands. You can come on camera, or if you can't come on camera, you can just place something in the chat so that we can make this as interactive as possible.
And I'll just introduce myself. I'm Vice President Cynthia Elliott with the Rochester Board of Education.
Thank you everyone for joining us. And I'm gonna have Erin go to the next slide. So as we just started to take a look at reopening plans for our district, we know that these particular populations and specialized programs are particularly struggling a great deal at home when you talk about remote learning. So these are the programs that we've identified for reopening in January, and they are include our New York State alternate assessment students, our students with autism and social communication and kids on the autism spectrum disorder, and our students that are working towards more skills and achievement credentials. And we're very excited to have them back and been working very hard over the last week or so to get everything ready to go. So that's where we are right now. And we're gonna just keep going because I know Erin and Stacy have quite a bit to share with you about the safety and health.
So we're gonna share a safety
right?
video.
Mm-hmm.
Hello, students, families, and staff. My name is Mike Schmidt, and I am the Chief Operating Officer with the Rochester City School District. I am happy to deliver this week's Friday message on behalf of Superintendent
We can't hear it. I don't know if anybody else is having trouble or can hear it, but we can't hear what he's saying.
No, I don't hear it either, the video.
I can't hear it.
No.
I did hear it for about 10 seconds.
Mm-hmm.
Make sure you're unmuted, because if you mute, then we can't hear it.
Oh, that's it. Yep.
Hello, students, families, and staff. My name is Mike Schmidt, and I am the Chief Operating Officer with the Rochester City School District. I am happy to deliver this week's Friday message on behalf of Superintendent Dr. Leslie Myers-Small. The purpose of this week's message is to prepare students, families, and staff for when some of our students return to school buildings in January. Last week, the superintendent announced that K-12 students with disabilities in specialized programs will be offered 4 days of in-person learning. We know many of you want to know what that will look like. Students and staff will wear masks at all times unless a mask break is given. This includes all shared spaces, like classrooms, bathrooms, hallways, and buses. Masks must cover your mouth, nose, and chin. This is the proper way to wear a mask. It is important to remember 3 key points. Avoid touching the mask with your hands. Use the straps to put on and take off the mask. And clean your hands frequently with hand sanitizer. The district will follow social distancing guidelines to provide 6 feet of space in all directions between individuals. Our classrooms are set up with desks 6 feet apart. Barriers may be used in situations when 6 feet of space cannot be maintained. Markers will be placed in common areas to indicate 6 feet of spacing. Each school in the district has a supply of personal protective equipment, or PPE. This includes cloth masks for employees and disposable masks for students who may need them. The district has also enhanced existing ventilation systems, increasing the fresh air exchange rate, and installing MERV 13 filters. All shared areas and common spaces will be cleaned and disinfected at least once daily and more frequently in high traffic areas. Teachers and other staff will be provided disinfecting supplies and training on how to clean their classrooms throughout the day. We need everyone to do their part to stop the spread of COVID-19. Parents, it is imperative for you to assess your child's health and take their temperature daily prior to coming to school. Staff, be sure to continue to complete your electronic screening assessment. This must be completed whether you are working remotely or actually working on site. Lastly, it is so important that we have your updated contact information. This applies to both the students and staff. Parents, please call your child's school to update your contact information, and staff members, please visit PeopleSoft to ensure your information is updated as well. Thank you for your continued support and partnership as we work together to ensure that safe, high-quality learning takes place for all of our students.
Hi everyone, it's Stacy. So you guys saw Mike's message, and basically what I'm going to do now is just kind of review it and go over some more of the details. So safety is at the forefront for us bringing back our students and staff for in-person learning. And Erin, if you could go to the next slide. Thank you. So our focus is on social distance, which if you guys have been out in the public, anywhere, you're familiar with that. We're going to maintain that 6 feet of space in all directions whenever possible. There's an activity that requires us to come in closer. Staff members will not only have on a face cover, which is the mask, they would also have on a face shield. We're going to focus on the proper use of the face masks, hand hygiene, keeping kids and adults' hands clean with frequent hand washing and/or hand sanitizer use. And then Mike also talked about the cleaning and disinfection, and I'm going to talk all about that just a little bit more. And you can go to the next slide, Erin. Thanks. So we talk about face covers or face masks. They have to cover the nose, mouth, and chin. They have to be worn in all shared spaces at all times. So anytime we're in a shared space, they would be on our hallways, restrooms, buses, places like that. They're going to be worn in the classrooms at all times unless there's a mask break given. The teacher would be giving that opportunity for the mask break. It will be short in duration, and it can only be provided when 6 feet of space is guaranteed. And usually during like a quiet activity, if that's possible. The less people are speaking and things like that, the less that they would be sending essentially their spit, for lack of a better word, sorry to say a word like that, out into the air. So that mask being on most of the time is gonna really provide an extra safety precaution inside of our buildings. There may be times when students can't wear them because the therapy is being provided. And in those instances, we will be covering we're providing other safety precautions. For example, I talked about a face shield that the staff member would be have on, and plus the mask. Also, they might be behind a barrier when that's going on. And you can go to the next slide, Erin. Thank you. Some of you may be wondering about if my child has an exemption, or how can I get an exemption for my child? I'm going to say that there are not very many exemptions for a face cover. If you believe your child would qualify for one, you're going to want to go to the Monroe County Department of Health website and contact your physician. Your physician would have to fill out the form that I have a little screenshot of on the slide, and they would have to sign it, and we would have to be provided with that. All other children who do not have this written exemption would have to wear a face mask. And what does that look like? That looks like starting to get them used to it now. One of the things that I did, whoops, the presentation went away for me. I don't know if it did for anyone else. It's okay.
Sorry about that. I had YouTube going in the background.
That's okay. I can talk over while you're getting it back up. One of the things that I did to prepare my kids for wearing a mask for longer times is when they were doing things they really liked to do, I had them wear it inside my house, outside the house, places we went, and I had them wear it for a long time. And my son actually, I let him wear it when he was playing video games, right? Because he likes those, and I don't like that he plays them as much as he does. So I said, all right, wear your mask. And he went to run outside to go kick around a ball in the yard, and he didn't take it off. And I realized he was still outside with it on. So they can get used to it. You can go to the next slide, Erin, thank you. Hand hygiene. So the focus on good hand hygiene, really making sure the kids are doing a great job, supervising that, washing their hands, getting their fingertips, the tops, the bottoms, 20 seconds or 2 happy birthday songs is how long we want our hands to be washed for, and also how to use hand sanitizer properly. You can go to the next slide. Thank you. Cleaning and disinfection will also take place in our buildings on a regular basis. Mike talked about that. We will be using the registered disinfectants that we have to use inside the space. We won't be using them directly, in front of a child, like spraying down a desk when a kid is sitting there, but they may be used around a child. And I just wanted to make sure that everyone knew that. We can go to the next slide. Ventilation, Mike talked a little bit about that in his video as well, but I just wanted to touch on it a little bit more. As you saw, we are replacing our filters with a higher rated MERV 13 filter. We're also going to run our ventilation systems for longer, which allows for more air exchanges, and we're going to be providing more fresh air than we already do to the buildings, which allows for more fresh air exchanges. We are required by code to already supply a lot of fresh air, but we're going to increase that even more. And then if it's practical and the windows can open, teachers can certainly do that as well. So we can switch to the next slide. And I think it's you now, Erin.
Yeah, good morning. So I just want to go over some things that need to occur or that we need from parents in order to keep our school environment safe. One of those things is going to be before school assessment by the parent. We are asking parents to take their child's temperature if you're able. If you do not have a thermometer at home, a temperature will be taken when they arrive at school, but it is preferred, if you do, that you take your child's temperature every day before they come to school. The questions that we also need answered prior to students coming to school is, has your child been in close proximity or in contact in the past 14 days with anybody who's been diagnosed with COVID? Have they tested positive for COVID in the past 14 days? Have they experienced any symptoms of COVID, including a temperature of 100 degrees or greater? And have they traveled internationally or outside of the US or the New York State travel advisory states in the past 14 days? So if you're answering yes to any of these questions, we ask that you keep your child home and reach out to the school and let them know why you're keeping your child home. And just to go over the symptoms of COVID. So the symptoms of COVID are a sudden onset of any of the following: a temperature of 100 degrees or greater, headache, shortness of breath, nasal congestion, loss of taste or smell, a sore throat, cough, vomiting, or diarrhea. So if your child has any of these symptoms, we ask that you keep your child home that day from school and contact the school. You will first let the school secretary know of the absence, and they will make sure you discuss with the nurse what it takes for the student to come back from school after they have any of these symptoms. Because many of the symptoms of COVID can mirror a common cold, they can mirror allergies, sinus infections, stomach bugs. So we really don't know if it's COVID or if it's any of those other things. So we are asking that you make sure to keep your child home, and we get some clarification from your child's physician. So if your child becomes ill at school, so if your child is at school and they come down with any of those symptoms, your child will be monitored in a space away from others until you can come pick them up. Please contact the school and make sure your contact information is updated. That's very imperative because we don't want anybody who could be contagious with COVID in the building for very long. This is so we can keep our school environment safe and prevent the spread of COVID or other illnesses. And just to touch on immunizations, we still have many children out in the community that are not immunized. We know that there's difficulty getting immunizations this year because of COVID, because of the difficulty getting to doctor's offices. So we need to make sure prior to coming to school that all students are immunized. Most of the area providers do have open appointments for this. We also have clinics within the community that can immunize students. So please reach out to your school nurse or your child's physician if you're unsure if your child needs immunizations. We've also put a resource list here. There is one for immunization resources that you can go to, and there's also information about COVID and the Department of Health toolkit for back to school. And we're going to take this time to answer any questions you may have.
And one thing I wanted to add that I realized wasn't there is in the video that you saw of a staff member walking through and sticking his hand underneath the device. That device takes a temperature, and students will be doing that as well. So it just looks like a little, it doesn't touch anyone, and you saw it in the video, it looks like a little, I don't even have a good description for it, a little camera almost. And then they just stick their hand under there. It either turns red or green. If it turns green, they go. And if it turns red, then they would be taken to the nurse.
I have a question.
Yeah.
I have a few. When you talked about the temperatures over 100, if we decide to keep our child home for any given reason, which like most kids, they have the common cold over the winter. Sometimes my son will cough all winter, whether it's allergies or just we have upper respiratory all the time in our family. How long before they can go back to school, and what's your procedure policy on when they can return? And my second part of that would be, if we have to keep them home, do they have access to online learning?
Great question. So I can answer the first part of that. So if we have children who are out of school because their parent has identified that they have a symptom of COVID, or because they've left school with a symptom of COVID, in order to return to school, we need evidence of a negative COVID test or a physician's note stating an alternative diagnosis. So if your child has some kind of medical condition that could involve any symptom of COVID, it's going to be very important that you have your child's physician write a note and get it to the school nurse. So we're not sending that child home for that reason. We really are looking, the nurses are looking for a quick onset and worsening of symptoms. We're not looking at, if it's a student who has asthma and there's a legitimate reason for their symptoms, we're not going to send that child home for that. We're going to treat their asthma. So we really need to make sure that we have documented the conditions that they have. Does that answer your question?
So basically you're saying though that if my son has a cough, there's potentially a week to 2 before he could come back to school?
So because we
Feasibly?
cannot identify if that cough is COVID or not, it is imperative that we follow, and these are policies and procedures that are put in place by the Department of Health that every other school district is following. They must have a negative COVID test if they have any symptoms, or a diagnosis from a doctor, an alternative diagnosis.
Do we know how long those, like what type of COVID tests? I've heard so many different, they can be rapid, they could be a week long, 2 weeks. Like what are we really looking at?
Yeah, so the rapid tests come back within 15, 20 minutes. If your doctor decides to do a rapid test, the nasopharyngeal test, which is the preferred test because they're more accurate, those come back within 24 to 72 hours.
Okay, so the second part of my question.
The second part, Shirley, can you answer that? Will online learning be taking place if a child within the special ed program is out?
So I think we're going to have to handle that just like, and I will research it more, but I guess it depends on how long you're out, right? Certainly if there's a medical situation where it's actually positive for COVID, then it falls into that access piece where we might have to set something up. But we're keeping remote teachers pretty much separate from classroom teachers because of, if you can imagine, the type of work is different. So if you're just ill for a couple of days, it's going to be just like any other absence and what you normally would have done when your child's out. You could, we could work things out with the teacher, and maybe there's ways you can get some of the work that has to be completed. But if it's a longer period of time, obviously we would make some kind of arrangement.
Okay, thank you.
Hi, good morning. How is the online learning for parents who have decided not to send their kids back in January? What is that going to look like?
So, well, I would hope that it's, oh, Shirley, do you want to, I do, thanks, Shirley, go ahead.
So we will have online learning continuing, and we have been working with our directors of our core subject areas to fortify that online learning. So we've heard a lot of concerns about the quality of the online learning. So certainly we're working with our directors to enhance the online opportunities, but certainly for families who choose to remain remote, will have that opportunity.
Okay.
I had another question. People aren't jumping in.
Sure, just before you go, Ms. Perez had her hand up for a while.
Oh, I'm sorry, I didn't hear.
Ms. Perez?
So good afternoon. I'm just, I don't know if my son falls into this because he was in a 12-on-1 program and now he's in a regular gen ed classroom. So, I mean, he's doing well with the online learning, but due to his IEP, I have a CES meeting with, I guess, the chairperson and everything in December. So I don't think he falls into this category because he's no longer in the 12-on-1 program.
No, you're correct. You're correct. If he's in a general education,
yes,
receiving support that way, that right now is not the population we're talking about at this moment for January.
Okay. Okay. Thank you.
You're welcome. We got Chrissy that raised her hand, and then I'm trying to see who's right under Chrissy. Chrissy, go ahead.
Hi, good afternoon. I have a lot of questions to ask, but not so much. My issues I'm actually having is number one, with the students that has to, well, like my son, he's gonna be home. And with him having to how to put it, the remote learning at home. And then I'm finding out a lot of different things from different people saying that, well, if your child is going to be home doing remote learning fully, you will not have the same teachers. Well, that's not fair to my child because he's improving with his teachers. So if his teacher decides to go in the classroom and then he's with another teacher that he don't know, and then not only that, he's going to fall off the track because he don't have his regular teachers in front of him. So how that work? And then two, with the mask situation, I know for a fact my child is not going to keep a mask on inside the classroom. I know that for a fact. I tried that at home and don't work. Now, on a different thing I have issue with is, okay, well, y'all saying it's going to be safe, but to me, I don't think it's safe because I'm hearing that where I'm hearing from a lot of parents too. I'm hearing from a lot of parents saying, oh, well, they said we don't have to wear a mask. My kids don't have to wear a mask. What? No, really, that's not safe at all. I know they said you can, kids have a choice to not wear their mask or whatever, but I feel like it's not safe because I don't even talk to my son's social worker. And she was like, you know what? That's supposed to be on the IEPs. It's supposed to have on the children IEPs stating that your teachers in the classrooms teach them by helping them by putting a mask on their face, by teaching them, by doing that. And I said, okay, well, it's not like that the way I'm hearing. So what could we do about that situation? And that's where I have my issues at. Like, okay, but I'm hearing A, B, C, and D, but what's going on with this?
So I'm going to try to address both those questions. The first one about the remote learning, we're trying to minimize changes of teachers as much as possible, but you're right. Unfortunately, some of that will have to change only because it's very difficult. You can't. We'll try to do as much as we can to minimize it, but I'll bring that again to our group because we're always looking at that and planning. The second one is no child with disability will be refused. I understand what you're saying. There are some kids that just will not wear a mask, and I've reached out to partners around who have opened, and they are not excluding kids who really, I know what you're talking about. They rip it off, they won't wear it at all. And then we have to practice good social distancing. But I really like what we're trying to do, and you're exactly right. Once we figure out this, and the teacher should immediately start working with families to try to get their child to become accustomed to wearing a mask. Kids, it's hard for parents, right? You can't even take your child out somewhere if they're not wearing a mask. So I think that has to be a primary focus as we're moving forward to help families. And I think Erin's had some great suggestions, and maybe we can come up with some more. We have kids that are sensory. They don't want anything. They don't even like certain clothes, right? Certain textures. So we have to be cognizant of that and try to work with families to get families, to help their children wear a mask, because it is very important.
And one thing that I'd like to add, if there is a child that we know really struggles and we don't have the waiver, like the signed thing, because it's not a medical reason, we can set up physical barriers. Now, it won't look like they're like in anything crazy, but it's clear, you can see through it, and they'd be set up a distance from them, but that would also create another barrier from them. They wouldn't be enclosed or anything like that. I don't want you to think that, but there's things that we can do to make it safer. And we treat that on a case-by-case basis. So for example, if there was a student who really couldn't keep their mask on and the teachers keep working with them, and it would be continual, just like Desiree said, but we would set up those safety precautions to make sure, and we would increase the social distance for that child. So maybe instead of making sure we have 6 feet, we would look at the 12 feet marker or the 10 foot, just so that we're making sure that everyone is safe.
right.
So,
But then too, I'm sorry, I have an issue with that though too, because I'm seeing that these different schools that's like, for instance, my niece school, and I just found this out last night, that they had a teacher with COVID and a child with COVID. I was like, what? But you don't know how to say, the teachers, you don't know the students. If they come in, you can say, yeah, they may not have it, but you don't know. It's from teachers, from parents, from anybody. It doesn't matter where it comes from. Mm-hmm. They got to still walk into the schools. And you don't even know if they're affected, because you don't know. Nobody don't know until they go get tested. And then when they get tested, it's too late to say, oh, well, oops, you know, what else?